Hi everyone, this is Janet Hill at the Rock Island County Health Department. Thank you for joining us. It's 3:30 p.m. on December 17th. Today with us we have Nita Ludwig of the Rock Island County Health Department, Ed Rivers of the Scott County Health Department, and Joel Moore, who is the Director of Care Coordination at Genesis, and also one of the first Quad Cityans to receive the COVID-19 vaccine. First of all, Nita, let's start off with some Rock Island County numbers.
Sure. Today we are reporting one additional COVID-19 death of a woman in her 70s who had been in long-term care. And we offer our deepest condolences to the family and loved ones of that person. Our total now in Rock Island County is 207 deaths. We have 104 new cases of COVID-19 today, and our total is now over 10,000. It is 10,036 total cases. 64 people are currently hospitalized in Rock Island County Hospital. Thank you.
In Scott County today, the number of cases is 13,236, and the number of deaths is listed at 128.
Okay, Nita, now we'll go ahead and hear from you first.
We are grateful for the excitement and the interest that is building around the COVID-19 vaccine as doses continue to be given in our community. While the supply is currently very limited, we know more will continue to make its way into our community each week, giving us the opportunity to ensure more and more of our healthcare workers are protected. We hope there will be this much excitement as we get to the general population and have our turn to get vaccinated. This vaccine is giving us a light at the end of the tunnel. However, the vaccine cannot do this alone. It is one of the tools that we have in our public health pandemic fighting toolkit. The COVID-19 vaccine will work in conjunction with wearing masks, social distancing, and hand washing as critical to slowing the pandemic. It's important for our community to understand that once someone begins to build immunity from this virus after they've received 2 doses of vaccine, that it does not mean they will immediately be able to run around mask-free and throw caution to the wind. It will take having large numbers of individuals vaccinated before we can begin having conversations about how to relax the social distancing and wearing of masks. For now, whether you will get the vaccine in upcoming days or not, you will still need to mask, social distancing, and wash your hands, and of course, stay home when you're sick. You know the usual, the things that you've been hearing from us over and over again for almost a year now. We do not say this to trample on the excitement that the vaccine brings. However, we want to make sure our community understands that the vaccine is just one tool that will help us get to where we need to go. Thank you.
Giving you the facts about safety, how well it's expected to work, and its ingredients are the only things that will help increase your understanding and comfort with the vaccine. Hearing from those who have gotten the vaccine gives insight into what you can expect should you take the vaccine in the upcoming days. We're very fortunate to be joined today by Joel Moore, a registered nurse and Director of Care Coordination for Genesis Health System. Joel was one of the first healthcare workers to receive the vaccine in our community and has been very willing to share his experience for the benefit of others. On behalf of both our health departments, boards of health, and staff, we'd like to take a moment to thank Joel, as well as the countless number of other frontline healthcare workers in our community for their tireless commitment to caring for this community during this critical time. You are critical partners in this pandemic response, and we're grateful for your support of our community. And now we'll hear from Joel.
So Joel, thank you so much for being here. We appreciate your willingness to share this as you have been the past couple of days through your Genesis Facebook page with the health system. And so we just have some questions here for you, and then we'll have our media partners ask them if they have some as well.
Very good.
So if you can do us a favor and describe your role in the COVID-19 response at Genesis, which, as we recognize, may have ebbed and flowed throughout the last 10 months with what you've been doing. But if you can give us some insight into that, that would be great.
Yeah, you bet. Thanks for having me. Thanks to both county health departments for the great work and communication and vigilance that you've had with COVID in our community. Appreciate your leadership in both those areas. So my role, I am the Director of Care Coordination, and my team, I've been a part of a team of leaders who have helped with the surge planning to make sure that we have had safe and proper tactics in order to make sure our teams are capable of taking care of patients. So out the gate, I was a part of that leadership team, and as the community saw in November, the cases surged rather quickly here in the Quad Cities, and my colleagues at the bedside needed extra help. So our CEO, Doug Cropper, put a call out to any nurse who had previously worked in the ICU or had worked at the bedside and was not currently doing that, asking for help to kind of help alleviate and supplement some of the nursing care that was being provided in our system. So I have a background and have worked in the intensive care unit before, so I said, put me in. And I got some training and competency and have been still picking up some shifts in our intensive care unit, helping to support my heroes, the ICU staff they've been in the trenches working for the past 9 months, and I'm there to provide whatever extra assistance and care and expertise to our COVID population and other members of our community in the intensive care unit.
Awesome, thank you.
Yeah, you
what
bet.
have been some of the biggest challenges you've experienced on the job related to COVID-19, and perhaps even just in these last 2 months with your time in the ICU?
Yeah, for sure. You know, I am just in awe at all of the clinicians and pharmacists and physical therapists and respiratory therapists, the whole sweep of caregivers that are providing amazing, exceptional care to our community in this pandemic. And I think the one thing that comes to mind is that the team that's at the bedside are emotionally depleted, that they pour their heart and their soul into the care of the patients and provide amazing care. And there just hasn't been any let up. You know, we went to this big surge in November, and our hospital numbers continue to be high still now, when we should be taking care of more routine patients at this point. Lots of surgeries usually happen this time of year, but that's not happening because we have some just really sick people in our community. And so I think the staff that have been in the trenches for 9 months, I would say they're exhausted, and they're doing an amazing job, and I'm so proud of them. So I think that's the one thing that comes to mind. I think just too, you know, our community is listening. When both the county health departments and both Genesis and Trinity said, you know, hey, you know, we need you to stop and pause and continue your vigilance with wearing your mask, washing your hands, and social distancing. I feel like that leadership that you all had helped our community just take a step back and helped us in the hospitals just hold the line, and we're able to take care of those that came into our doors.
Now, if we kind of pivot to talking about the vaccine, sure. Can you describe why you chose to get the vaccine when it was made available to you?
Yeah, you bet. I'm a clinician. I'm a registered nurse, and we make every decision based off of scientific proof. And I have 100% confidence in the FDA and in the CDC, and I have 100% confidence in the work that has been put into this vaccine. I didn't, without any hesitation, I said, put me in. I'll do it. I will take it if this is the right next step for us. And so Genesis, a couple weeks ago, put out a survey to all employees that said, if you are interested and willing to take the vaccine, fill out the survey and sign up. And then they started scheduling us, and I happened to be on the first day. So I did it because I trust the system. I trust the process. I trust all the amazing scientists and experts that have put countless hours and energy into this for the success and to edge us towards more hope of normalcy.
So now, can you walk us through what was your experience getting the vaccine? And then kind of
Sure.
the second part, if you've experienced any symptoms in the following days. So you're on day 2, correct? Or I guess day 3, however you want to call that.
Yeah, right. Yeah, day 2. I got my vaccine about 6 o'clock on Tuesday evening. And it's just like any vaccine, it's an intramuscular shot. So I got it in my left arm and didn't feel anything. The next morning, woke up and had a little bit of tenderness and soreness in my arm. And, I'll be honest with you, I think we have been educated on all the side effects that could happen. And there's lots of worry out there from people. So I had a lot of mind games yesterday thinking, well, gosh, maybe I have a headache, maybe I have fatigue, maybe I have these things. But really, I felt really great except for my arm pain. And if you've had a vaccine before, or I kind of attribute it to, mine was like if you had a tetanus shot, sometimes your arm aches a little bit. By the time I went to bed last night, that was all gone. So I am A-okay and feeling great today. I guess we'll call it normal, whatever normal is. So I feel good.
Perfect. So as a local healthcare worker, what does the future look like to you now that the vaccine is slowly becoming available in our community?
Yeah, I think, 2 words come to mind. One is, as a local healthcare worker, I think first is trust. I want to say to my colleagues, that are in the healthcare field, we have to trust the process and get vaccinated. And then we need to go out and tell our community that it's going to be okay and convince them, because I think there's still some convincing and some people oscillating, that they can trust that this is what is needed in order for our community and the world, it's a worldwide pandemic, to move back to a sense of normalcy. And then the second thing that comes to mind is vigilance. I think it was Rita that said, we still have to maintain vigilance in wearing our mask and hand hygiene and social distancing, as well as making sure that we, if we got the vaccine that requires 2 doses, that we get that second dose. And that doesn't mean it's time to take off the mask for a mask burning party, that we still have to be vigilant. And those are the 2 things that come to mind when I think about where we're at and where we're headed.
So one last question here is, what would you say to others who are able to get the vaccine, maybe at this point or in the future? What would be your advice or your recommendation?
Yeah, my friends and colleagues will laugh at me because they hear me say this a lot. I think just be all in. I think just sign up, be willing. I know that even if you have some nervousness, we're right here. We're going to support you. Talk to people who have had the vaccine. So I think I would just tell our community, trust the process. I want to be a leader. As a nurse and as a citizen, I want you to know that, my call is to say, hey, it's going to be okay. And I'll walk with you. There's lots of us out there who want you to take the vaccine, maintain all the things that we need to keep doing, and be a good citizen, and know that we're moving towards the other side of, hopefully we're on the down curve of this worldwide pandemic, but I'm not sure. We don't know what the future holds. So I say in the meantime, sign up to get the vaccine as soon as it's time for your tiers, or however the state guides us to make sure that happens.
Awesome. We do have one question in here from a local member of the media, and it says, Joel, as an ICU nurse, I'm curious as to your feelings about those who still call COVID just the flu.
Yeah, that's a good question. I was talking with a friend the other day, and COVID deaths are the number 3 in the United States now this year. So behind heart disease and cancer will be COVID. And I was sharing with this friend that over 300,000 people now just in the United States have died because of COVID or COVID-related illnesses. And so to attribute COVID to the flu, I want to say, you know, look at a different news source, or look at all the lives and the empty chairs around the tables this season, and just recalibrate a little bit, because we're at the front line. We're pouring a lot of time and energy and care into these folks, and just have an open heart to see that there's more out there.
And then as a follow-up to that, I'm wondering if this is the same question. I'm wondering about the impact of the vaccine on the morale of those with whom you work.
Yeah. Oh my gosh. I was at the clinic on Tuesday night, and it was just electric. The feeling in the clinic was electric. And I know I was talking to some folks that were at the Silva's clinic yesterday. We are so excited because it just is another step towards hope and a little bit more closer to normalcy, or to the other side. So it's been a big morale booster for us. You know, it's no longer, we're not talking about PPE or surges that are coming, even though we maintain vigilance on those things, and we don't know what will happen after the holidays. And but it's our one glimmer of hope that we see something positive happen. I was even with that little pain in my arm yesterday, I thought this is a tangible sign of hope, that things are changing and improving for us. So it's just a morale booster and good energy.
That's a perfect ending for that. I don't see any additional questions typed in. I think you covered so much very well.
Okay.
Do you have any final thoughts that you would like to share?
I don't. I think just trust the system, trust the scientists and our FDA and CDC, and be good stewards of our resources and sign up for that vaccine. We got this.
Well, thank you so much. We appreciate your time and sharing some of it with us today. Please send our best regards to all of your colleagues there. And for those on the call, this is being recorded. It will be posted on the Scott County Health Department's website, as well as the social media pages for both of the organizations. And Joel, again, we thank you. You can catch him on the Genesis social media pages, giving some updates as he continues to work and go through this. And we're grateful for your sharing. So thank you. And thank you everyone for joining us today. Have a great afternoon and a safe week.
Thank you. Thanks everyone.